Hello and welcome. I'm Dr. Jennifer Dimino, and I'll be talking about understanding nausea and vomiting and empowering you to manage your symptoms and talk with your provider. So, getting right into it, what are nausea and vomiting? Nausea is that uncomfortable sensation that you feel that you might throw up, and then vomiting is actually the action of forcefully expelling your stomach contents. And these are symptoms, but they are not diseases on their own, and they can occur together or separately. Retching or dry heaving, as well as regurgitation, where food comes up effortlessly, are separate and different experiences and symptoms. So, what usually causes these symptoms? Most cases of nausea and vomiting are caused by mild or short term illnesses that tend to get better on their own. Most common examples include stomach bugs or viruses, food poisoning or bacterial infections, motion sickness, and even migraines or medication side effects can cause nausea and vomiting. People often can experience nausea and vomiting with stress or anxiety, as well as with pregnancy. How do these symptoms occur? These symptoms are often caused by complex interactions between the GI tract and the brain, and it's mediated by the intrinsic rhythm of the stomach, as well as the autonomic nervous system with both sympathetic and parasympathetic signaling, including the vagus nerve. And lastly, brain and brainstem reflexes that induce vomiting. When could this be a sign of something more serious? In very rare circumstances, nausea or vomiting could be a sign of a more serious problem. Most commonly, we classify gastrointestinal causes into three types: structural or anatomic causes, like a bowel obstruction, gallstones, pancreatitis, or even an infection or inflammation. Motility disorders, such as gastroparesis or acid reflux, can also cause nausea and vomiting. There are lastly disorders of gut-brain interaction that can cause nausea and vomiting symptoms. And these include chronic nausea vomiting syndrome, cyclic vomiting syndrome, cannabis hyperemesis syndrome as well. A careful history, including how often you experience these symptoms, when you experience them, and what else is going on, can help guide the workup that you would need. In some cases, eating disorders like anorexia, bulimia, or even avoidant restricted food intake disorder can contribute to these symptoms. So if you have been avoiding food or are forcing yourself to throw up, it's important to talk with your provider about this. What are red flag symptoms and when should you seek medical help? You may need to visit an emergency room if you're having nausea and vomiting for more than 1 to 2 days, an inability to keep down fluids, any severe belly pain, vomiting that looks like blood or even coffee grounds, weight loss, especially unexpected weight loss, and dizziness, confusion, or a high fever. And what might be causing symptoms? We'll look at constellations of symptoms that might give a hint or a clue to what's going on underneath. If you're experiencing heartburn and nausea in the morning, that might suggest acid reflux or GERD. Nausea and vomiting that occurs hours after eating could be gastroparesis or delayed stomach emptying. Nausea with right-sided abdominal discomfort, particularly after eating fatty foods, could be a suggestion of gallstones. Repetitive vomiting episodes with long vomiting-free periods in between might be a sign of cyclic vomiting syndrome. Frequent vomiting in a daily and heavy cannabis user may suggest cannabis hyperemesis syndrome. Avoiding food, vomiting on purpose, or having a fear of eating may be signs of an eating disorder that needs to be addressed. Daily nausea, especially early in pregnancy, may just be morning sickness and is often expected or normal in mild cases. If you have a recurrent headache with vomiting, that may represent migraine headaches. So, you're having nausea and vomiting. When do you need tests, and what tests might you need? A provider that you speak with may suggest lab tests to check on your hydration status, electrolytes, as well as for any infection or inflammation. Imaging, like an ultrasound, CT scan, or gastric emptying scan, may also be ordered. An endoscopy, which is a camera test to take a look into the stomach, can be considered in certain circumstances. Not every individual will need every test. Your personal and family history, as well as your lifestyle and associated symptoms, will help guide that workup. Repeated testing, such as multiple CT scans or repeated endoscopies, may increase radiation or procedural risks if they're not clearly needed. When you're having nausea and vomiting, what can you do at home to feel better? Some tips include taking sips of clear fluids like water, chicken broth, or even electrolyte drinks. You should eat bland foods. Toast, rice, applesauce, banana, or even soup might be more tolerable while you're having nausea or vomiting symptoms. It's recommended to avoid spicy or greasy foods or strong smells that could trigger nausea or vomiting. Rest as much as you can and avoid lying flat right after eating, which can contribute sometimes to reflux. Also, try over the counter remedies, and you can check with your provider about which may be safe for you. Or even natural remedies like ginger chews can be helpful for nausea. What medications might your provider prescribe to you? A provider may give you a prescription for antiemetics. These are anti-nausea medications like ondansetron, Zofran, or promethazine, and more. Prokinetics are medications that help the stomach move or empty, such as metoclopramide or erythromycin. Antacids are medications that decrease stomach acid, like famotidine or omeprazole, and may be indicated with acid reflux or other symptoms. Neuromodulation are any medications that work on the nerve signaling pathways and disordered gut-brain interaction to impact nausea and vomiting. And lastly, you might have a recommendation for a change in other medications that could be contributing to nausea or vomiting. So if you're having nausea that keeps coming back or bothering your daily life, please talk with your provider. This is a real life example of a patient, Miss Maria. She's a 50-year-old teacher who began having nausea every morning. At first, she thought it was related to stress, and she did improve by drinking ginger tea in the mornings. However, after symptoms continued for a month, she spoke with her provider and learned one of her newer medications might be the culprit. By changing that medication to a similar one, she was able to have a huge impact on her symptoms and no longer experience daily nausea. So remember, always tell your provider about your symptoms so they can help you. How to talk to your provider and what information to share with them. Most importantly, you need to know when have your symptoms started, as well as how often they happen and how long they last when they do occur. If there are any medications or actions that make you feel better or worse, take note of that. Additionally, if you've been having any changes in your weight, sleep, or daily routine, it's important to make note and tell that to your provider. Medications, diet, recent travel, as well as alcohol, cannabis, or any substance use would be relevant to tell your provider. If you've been avoiding food, had changes in your eating habits, or have any concerns about your relationship with food, those are also important topics to discuss with your provider. When you are wanting to talk with your provider, it's important to track your symptoms so you can give them an accurate idea of what's been going on. Why is it useful? You might notice patterns in your nausea or vomiting, and it gives your provider clues into what might be going on. So when you're beginning to record symptoms, make a note of when they happen, as well as what you may have eaten before, and then any associated factors like stress, travel, menstrual cycle, or other triggers that you've noticed. And any medications or actions that you tried that helped or made your symptoms worse. Online or phone apps do exist, but they might cost money. And so a simple log on your calendar, on a phone, or by paper will work easily as well. Take-home messages for patients to speak with their providers and manage their symptoms at home. Remember that most causes of nausea and vomiting are not life-threatening, and they tend to go away on their own or get better in a short period of time. However, if you're experiencing recurrent or persistent symptoms, it's important to keep track of your symptoms and to talk with a provider. Don't hesitate to talk with someone that's able to help you. If symptoms are persistent or severe, they may point to something more serious going on that needs treatment. Seek more immediate attention if you're having red flag symptoms like a prolonged inability to eat or drink, vomiting blood or coffee grounds, any severe belly pain, as well as a high fever, confusion, or weight loss. Questions and resources for patients. Please bring any of your questions to your provider and use a symptom tracker, whether that's on paper, on a calendar, or through an application so your provider can have a better idea of your symptoms. And lastly, a helpful resource is the IFFGD website, which is a trusted resource for GI information. Thank you.